Principles of Medication Administration Part 1. A nursing student is preparing to administer an intramuscular injection to an infant. The nurse preceptor instructs the student to use which injection site? A. Vastus lateralis, B. Dorsogluteal, C. Deltoid, D. Trapezius. The correct answer is A. Vastus lateralis. When administering an intramuscular injection to an adult, the nurse ensures proper insertion depth by choosing a needle length of A. 0.5 to 1 inch, B. 1.5 to 2 inches, C. 0.75 to 1.25 inches, D. 1 to 1.5 inches. Correct answer is D. 1 to 1.5 inches. A nurse is preparing to administer intravenous fluid that lowers serum osmolality and pull fluid into the intracellular space. Which fluid should the nurse administer? A. Supratonic, B. Hypotonic, C. Isotonic, D. Hypertonic. The correct answer is D. Hypotonic. The nurse is administering an insulin injection. The nurse decides the best site for this type of injection is the A. Outer aspects of upper arms, B. Anterior aspect of thighs, C. Abdomen, D. Superior buttocks. Correct answer is C. Abdomen. A patient with a potassium level of 2.9 milliequivalent per liter prescribed potassium chloride 40 milliequivalent IV. The patient has only the peripheral intravenous. The nurse should administer this medication A. Over 5 minutes, B. In a central venous line only, C. With lidocaine intravenously to reduce irritation, D. Over 4 hours. The correct answer is D. In a central venous line only. An elderly patient is admitted to the hospital after several adverse reactions to the prescribed medications. The patient may benefit from A. Longer administration intervals with increased dosages, B. Additional medications to reduce the side effects, C. Smaller dosages, D. Weekly visits to the patients. The correct answer is A. Longer administration intervals with increased dosages. The nurse is preparing to administer vancomycin 500 mg IV over 60 minutes. The solution is 250 ml and the intravenous tubing has a drip factor of 15 GTT per ml. What is the drip rate? A. 25 GTT per minute, B. 50.5 GTT per minute, C. 60 GTT per minute, D. 63 GTT per minute. The correct answer is D. 63 GTT per minute. A nurse is preparing to administer a lipid emulsion to a patient requiring total parenteral nutrition. Which of the following fatty acid is present in lipid emulsions? A. Arachidonic acid, B. Allylic acid, C. Oleic acid, D. Linoleic acid. The correct answer is linoleic acid. A nursing student administer is an intravenous medication but forgets to prime the syringe. The patient then becomes confused and pale, suspecting an air embolus. Which is the appropriate response? A. Place the patient on their left side or in Trendelenburg position. B. Place patient in semi-fabulous position. C. Place patient in high fabulous position. D. Place the patient in a supine position. The correct answer is A. Place the patient on their left side or in Trendelenburg position. After administering a subcutaneous injection, the nurse should recap the needle and save it for the next administration. A. Discard the uncapped needle into a sharp container. B. Recap the needle and discard it in the trash. C. Recap the needle and discard it into a sharp container. The correct answer is A. Discard the uncapped needle into a sharp container.